everybody, this is NursenieZl and welcome back to my channel. This video is solely for demonstration purposes as interpreted by the actor based on her understanding of the specific skill with reference to the Royal Marsden Manual of Clinical Nursing Procedure 10th edition. All information presented are public domain materials accessible through the relevant governing organizations' websites. Subtle similitude may be noticeable, however, this is not intended to be definitive guide to the NMC Part 2 Test of Competence or the OSCE examination. This can be a helpful material for overseas or internationally trained nurses to learn and adapt to the UK clinical settings and transition effectively into practice. And yes, today I'm going to show you how to demonstrate and how to pass this very easy skill. Again, this is Catheter Specimen of Urine Collection. Nurses, you have to do this station within 8 minutes. ID check and consent has been done, so all you have to do is to perform the procedure. Disposable trays are used occasionally, but sometimes they only give you a trolley. You make sure that you use either of the two. It's either tray or trolley. Nurses, remember this. The candidate that takes the urine specimen sample from the incorrect port, either the leg bag emptying port or the water balloon port, will result into a fail. So you have to make sure that you know which port that you have to collect this urine sample, okay? Also, nurses, please remember this. CSU or catheter specimen of urine is a clean procedure. Please do consider wearing appropriate PPE while touching the catheter, clamping, unclamping the urine tube, wiping of the port, and always observe this. Always observe the non-touch technique whilst transferring from the syringe to the urine bottle. Now, nurses, are you ready to learn this skill? Very well then. Don't forget to hit the like button and subscribe to my channel. Also, if you want to get notified just in case I post more OSCE videos, then hit the notification bell. Comment down below what other OSCE videos you want me to do next. Let's do this! Oh yeah, let me remind you that in this station, you will be given a prescription like this. I'm gonna put it on the screen right there. Also, you're gonna have one of these, the microbiology form. I'm gonna put it on the screen as well. So those are the two that you will have before you do this station. First thing I'm going to do is to gel my hands with 5 backward and forward strokes from palm to palm, right palm over the left dorsum and vice versa. Fingers interlace, fingers interlock. Rotation rubbing of the thumb, vice versa, rotation rubbing of the finger clasp, and rotation rubbing of the wrist. Let it dry for 30 seconds. Now I'm ready to go to my patient. But before going there, I need to wear my gloves and apron. Okay, apply the apron. Get some gloves. Okay, now that I have done my gloves and apron, I'm gonna go now to my patient, okay? Okay, before stepping to the patient's place, making sure that the scene is safe. Hi, I'm NursenieZl.
Hello, Nizel.
Yeah, hi. I am here today because I need to collect a urine sample from your catheter, if that's alright with you.
Oh, yeah.
So according to your prescription, you have been diagnosed with a urinary tract infection. That's why we needed this sample and to be sent to the pathology. And according to your prescription as well, that you are about to start your penicillin antibiotic. Is that right?
Yeah.
Since according to the examiner, ID check and consent has been done, I'm just gonna ask the patient's preferred name. What do you want me to call you?
Just call me Sharon.
Sharon? Okay, Sharon. So basically, I am here to collect some urine sample from your catheter port, okay? So what I'm going to do is to make sure that the privacy and dignity of the patient is maintained by closing the windows, the doors, or the curtain, okay? Sharon, are you comfortable? Do you have any pain at all?
I'm not in pain at the moment.
Okay. Would it be okay if I proceed?
Yeah.
Okay, let me just look at the catheter.
Okay.
Okay, let me just check the catheter. So assuming there is a catheter this is the catheter bag and this is the extension bag. So it's a metered one. Yeah, it's a Eurometer. Okay, so what I'm going to do, just assume that there is a urine inside. So if there is no urine visible here, you have to manipulate the catheter tubing. Okay, you can also ask the patient to move a little bit or to supine or a little bit in the position in which the urine will flow. Okay, now you have to clamp the catheter using a non-traumatic clamp a few centimeters below the sampling port. So this is the sampling port, few centimeters. Now I'm gonna clamp it. Sharon, now I've already clamped it. Now I have to wait 30 minutes before I start the procedure. So I'll be back. If you have any other concern, please ring the call bell. Yeah?
Alright.
Okay, thank you. So I'm gonna remove the gloves, throw it in the clinical waste bin. For the apron, again into the clinical waste bin. Now I'm gonna gel my hands. And after this, I am going to wash my hands using these steps of hand washing in accordance to the World Health Organization. This is now the new steps of hand washing in accordance to the World Health Organization. First, I'm gonna wet my hands. Get some soap with 5 backward and forward stroke from palm to palm. Right palm over the left dorsum and vice versa. Fingers interlaced. Fingers interlocked. Rotational rubbing of the thumb. Rotational rubbing of the finger clasp. Vice versa. And rotational rubbing of the wrist. Rinse it thoroughly with water. Then pat it dry with clean towels. And dispose it accordingly into the domestic bin. And that's how you wash your hands using the steps of hand washing according to the World Health Organization. Miss Examiner, is this trolley clean with soap and water for the last 24 hours?
Yes, it's clean and ready to use.
Okay. Okay, now that the examiner said it's already clean with soap and water for the past 24 hours, I'm not going to clean it with Cleanel wipes anymore. But if it's not clean, then you have to get a Cleanel wipes. Make sure that you clean it from the farthest to the nearest. Yeah? And let it dry for 30 seconds. Wearing gloves and apron. Okay? Please, examiner, is this a disposable tray?
Yes, that's disposable.
Okay, I'm going to put it here. Now I get here the syringe, 10 ml syringe. So it's clean and intact. Expiration date is 11th of 2025. So I'm gonna put it on my tray. Okay, 2 alcohol swabs. Expiration date is 10/2023. Clean and intact. I'm gonna put it here. I have got here the universal specimen container. So again, clean and intact. Make sure that it's labeled. Okay, make sure that this is labeled with the patient's details. Name of the patient, date of birth, ward, wherever the patient is ward, what kind of specimen, date of birth, date, and then the time that you collected the specimen. Unsterile gloves, appropriate documentation and pathology form. So this is it. This is the pathology form. I'm gonna gel my hands. I'm ready to go now to the patient. I've got everything that I needed here. Okay, apply apron. After I apply my apron, make sure that the privacy and dignity is maintained. Again, just in case it wasn't during the first take. Now, I need to make sure that the patient is comfortable. Are you comfortable?
Yes, I am.
Are you still happy for me to proceed?
Yeah.
Okay, so before that, if the patient have a blanket over the catheter port, make sure that you uncover the patient. Like I said, provide privacy and dignity beforehand, okay? So now I can see that the port is exposed. I'm gonna gel my hands. And then let it dry for 30 seconds. I'm gonna apply now the gloves. Obviously, I have to make sure to help the patient in a required position. Again, if you like this video, don't forget to give this video a like and subscribe to my channel. And if you want to get notified just in case I post more OSCE videos, then hit the notification bell. Guys, comment down below what other OSCE videos you want me to do next. Okay, so first thing is make sure to open the syringe. So before I clean that port, because I have to make sure that when I'm cleaning it, my hand should be in there at all times. So here's the technique. Open the bottle first, let it loose. There you go, now it's loose. That's the time that I'm gonna open the cleaner wipes, okay? Assuming that I have opened it. Okay? Now, the moment I hold this one, I'm not allowed to remove my hand here anymore. So I'm gonna clean the port for 30 seconds. Okay? Now, let it dry for 30 seconds, okay? Make sure that you do not leave the port. Leave your hand in there until the procedure is finished, okay? Leave your hand in there. Now, assuming that the port is already dry, it's been dried for 30 seconds, what I'm gonna do is to insert the syringe firmly into the center. There you go. Now, this is the sampling port using a non-touch technique. Aspirate the required amount of urine and then remove the syringe rapidly.
Yeah, it's 10 mils.
So I'm gonna put it now here in the sterile container or universal specimen container, making sure not to touch the key parts. There you go. Make sure that it's sealed and labeled. Throw it in the clinical waste bin. Okay. The rest of the used packaging. Now for the remaining alcohol, we need to clean the sampling port, okay? Clean it for 30 seconds and let it dry for 30 seconds at the same time. After the procedure, you have to unclamp the catheter now and cover the patient. So I got here the sample now. Make sure that it's labeled. I'm gonna remove my gloves and apron. Now I'm gonna gel my hands. Let it dry for 30 seconds. Now I have to make sure that the patient is comfortable. Sharon, are you comfortable at the moment?
Yes, I am.
So we are now done with the procedure. Yeah, I just need to document. Yeah, if that's all right with you.
All right.
Okay. So now I'm gonna document. And this is how we document in the microbiology form. But sometimes verbalization is accepted. Okay, now that I'm finished documenting, I'm gonna finish the procedure. Sharon, we are, like I said a while ago, we are now finished with the procedure. I'm gonna go now. If you need anything or if you need me, here's the call bell. Yeah, don't forget to call, okay?
Okay.
Here you go. Then after the procedure, I'm gonna make sure that I dispose this tray because it's a disposable tray. Ensure that the label of the specimen is there and accurately filled in. Also, we have completed the microbiological request, including the relevant clinical information of the patient, the signs and symptoms, antibiotic therapy, and the likes. Making sure that the curtains, windows, and the doors are now open, making sure the patient is comfortable, and I'm gonna wash my hands using the 6 steps of hand washing. Can I just remind you, I've used this trolley, so I make sure that I have to wash it with soap and water after the procedure. And that's the end of the catheter specimen of urine collection. And just like that, we are now finished with this procedure. I hope you learned something for today. If you like this video, don't forget to give it a like and subscribe to my channel. Also, if you want to get notified just in case I post more OSCE videos, then hit the notification bell. Can I just say, comment down below what other OSCE videos you want me to do next. This has been NursenieZl. See you on the next one. Bye! Okay, so today there's gonna be a new thing on my channel. If you are a subscriber or a member, please do become a member. So I'm gonna do a shout out to you. The shout out goes to... There you go. Rose Morastil, congratulations! Thank you so much for supporting my channel. Thank you, thank you, thank you. I'm really glad that my channel helps you to pass your OSCE exam. Thank you so much. Keep subscribing, okay? And again, congratulations. I wish you all the best, alright? So for everybody who wants to join the shoutout section, please do comment down below and also click the membership or the notification bell. See you on the next one.